Good morning, everyone. I am Dr. Vijeta, and today we are going to discuss prediction models which are used in unexplained infertility. What are the role of prediction model in unexplained infertility? So, in unexplained infertility, these prediction models help us to guide treatment decisions by estimating the likelihood of natural conception. Let's discuss first the dilemma of unexplained infertility. Unexplained infertility is like a glass with half water and half empty. Half water depicts that there is nothing abnormal. This is just a period of subfertility and it will resolve on its own. But half empty will represent we cannot identify the cause. If we do not identify the cause, then how will we treat it? So this is very frustrating for the patient that the cause is not known. So how will my physician will treat me? As we know that unexplained infertility is full of uncertainty about achieving the live birth. So, to overcome this dilemma or uncertainty about infertility, there are various prediction models which help us to guide about the treatment and thus prevent the over-treatment of the patient. So, if the prediction model says that the chances of natural conception is good, then we will allow the patient to undergo expected management. If it will say that the chances of live birth is low, then we'll go directly for the treatment and not going to the expected management. Thus, prediction model help us to guide the treatment decision of natural conception. Let's discuss the prediction model. Hunault's model. Hunault model is the standard established prediction model for natural conception and it is also known as synthesis model. In this model, they have collected data from three cohort study of subfertile couple and these study were named as Emmer, Collin and Snick according to the first author name. So let's first discuss these three studies briefly so that we will be able to understand the Hunault study correctly. So in these three studies, which was done by Ammer, Colin and Snick, in Ammer study, Colin study and the Snick study, the outcome taken is spontaneous pregnancy rate within 1 year after the intake, and they have taken the couple without tubal and ovarian disorder. And the parameters taken are first is the duration of infertility, the second is the woman age, third is the pregnancy history, sperm factor and the postcoital test. And in colon study, the PCT test is not available. Okay, let's now discuss Hunault study. In Hunault study, they have taken data from all the three samples and they have constructed the two models. First is three sample model, the second is two sample model. Three sample model included the variables which are available in all the three samples and it included five variables. The two sample model included five variables which are present in all the three studies plus PCT which was not available in the colon study. That is, it included six variables. Let's discuss the variables present in the Hunault study. Let's discuss what all variables are included in Hunault study. In Hunault study, it is basically the integration of the three previous cohorts. So it includes five variables. The first is female age, second is duration of infertility, third is primary or secondary infertility, fourth is the percentage of motile sperm, and fifth is the referral status. That is where the general practitioner or the fellow has referred the patient. So this is basically the variables which are present in the Hunault study. And Hunault study, let's calculate the score. How will we calculate the score? Then we'll be able to understand. First, the parameters, the variables, that is woman age, duration of sub-infertility and type of subfertility, motility, referral status. These are the variables used. And they have given the score according to the 3 sample, according to the 2 sample model. As we know that the 3 sample model will only include the 5 tests and the 2 sample will have an addition of postcoital test. Let's do an exercise calculation of the Hunault score. So if the woman is 28-year-old, she'll get the score of 3. If the duration of subfertility is 2 years, then will we get a score of 3. If she is primary infertility, then we'll get a score of 8. If she has 30% sperm motility, then she'll get a score of 4. And if she was referred from gynecologist, then she'll get a score of 4. So as we know, let's calculate the score for 3 sample model. So the score for 3 sample model, if we add these values, it will come out 22, and this score will correspond to the cumulative 12-month spontaneous pregnancy rate of 21%. Let's hope everyone will understand how to calculate this score. This is just a little exercise for you. Let's discuss this graph. In this graph, the x-axis will represent the prognostic index score and the y-axis will represent the predictive 1-year live birth rate. So in the previous slide, we have calculated the prognostic index score, which was 22. So if I plot 22 around here and then go straight, it will meet the curve around here, and then we see the value on the y-axis. So it is around 25. So the predictive 1-year live birth rate was around 25 if the prognostic score is 22. This is how we'll be able to find out the 1-year live birth rate. Let's discuss the implication of Hunault model. So the implication of Hunault model is this: if the patient with couple with unexplained infertility will calculate the prognosis for natural conception over a 12-month period, if it is more than 30%, then we can easily ask the patient for 6-month expectant management. If it is less than 30%, that means the patient should undergo straight away IUI with hyperstimulation. If IUI with hyperstimulation is not successful, then we'll go to IVF. And this is how we will use this model to treatment. For the treatment, which is the initial treatment, either it is expectant management or it is ovarian stimulation with IUI. So this is the role of the. Let's discuss another prediction model, that is benchtop prediction model. It includes the Hunault model predictors plus additional 7, which is woman body mass index, cycle length, basal FSH level, tubal status, history of previous pregnancies, semen volume, semen. This is the picture showing all the variables which are used in the Bansdorf model, like woman age, duration, then FSH level, the referral center, and all those 12 variables which are used and their respective score. So after adding the points for Bansdorf model, they will give the probability of 1 year of natural conception rate. So this is around the probability they have given, and according to this probability, we will decide our initial plan of management in patient with unexplained infertility. The advantage of this model as compared to the Hunault's model is that it concur better with the observed pregnancy rate as compared to the Hunault's model. The second one is it allows adjustment at a repeated interval of time, thus provide prediction once the couple has also returned from initial expectant management. I hope you enjoyed this lecture. This is all about the prognosis scoring of unexplained infertility. Thank you.